everyone, my name is Anushka and today we will learn how to describe a pathology specimen, and we'll also learn about some pathology specimens of general pathology. So, how to describe a specimen is step 1. First, you have to identify the organ, okay, and always try to tell whether the pathology is focal or diffuse. Step 3. If the pathology is focal, always try to describe it from outside to inside so that you don't miss out on any points. Okay, so tell about the rough size and location of the focal pathology, and always tell whether the borders are well defined or if they are ill defined. On the cut section, whether it is homogeneous or variegated. If possible, you can describe the color and texture. Okay, so this is the well preserved specimen of spleen which shows leukemic infiltration. Here you can very well see diffuse tiny nodules in the spleen. Okay, so what is leukemic infiltration of spleen? It is a pathologic change in leukemia in which leukemic cells permeate spleen, and they may show various degrees of infiltration depending upon the type of leukemia. Okay, so now the examiner can ask you many questions about the leukemia, about various types of leukemia, and for the sake of practice, I'll also ask you some questions about spleen. Okay, so the first question is, what are the lymphoma or the leukemia which involves the red pulp of the spleen? What are the leukemia or lymphoma which involve the red pulp of the spleen? And the answer is hairy cell leukemia, and hepatosplenic lymphoma. Okay, now name the leukemia in which name the leukemia which is characterized by massive splenomegaly. The leukemia which is characterized by massive splenomegaly, and the answer is yes, CML. Now here comes our next specimen. So our next specimen is a well preserved specimen of matted TB lymph node. So first of all, what do you mean by term matted? Matted means a group of fused lymph nodes. Okay, matted lymph nodes are not specific to tuberculosis. It can be seen in many other conditions as well, but in tuberculosis you will see carious necrosis. Okay, so the other conditions in which matted lymph nodes can be seen are the conditions can be divided into two categories, that is benign and malignant. So the benign conditions in which matted lymph nodes can be seen are TB, sarcoidosis, and the malignant conditions in which matted lymph nodes can be seen is lymphoma and metastatic carcinoma. So our next specimen is a well preserved specimen of Hodgkin's lymph node chain. As you all know, Hodgkin's lymphoma spreads orderly by maintaining contiguity. It shows contiguous spread, whereas non-Hodgkin's shows non-contiguous spread. So this is a specimen showing contiguous affected lymph nodes. Okay, now in this particular specimen you can be asked about the difference between Hodgkin's and non-Hodgkin's, the pathogenesis of Hodgkin's lymphoma, the types of Hodgkin's lymphoma, that is nodular sclerosis, mixed cellularity, lymphocyte rich, lymphocyte depleted, lymphocyte predominant, the clinical features of Hodgkin's lymphoma, that is the painless cervical lymphadenopathy, and it presents with pale Epstein fever and the paraneoplastic syndromes which are seen in Hodgkin's lymphoma, that is secondary amyloidosis and alcohol induced pain in lymph nodes. Okay, you can be asked about the prognostic factors of Hodgkin's lymphoma, and last but not least you can the Ann Arbor classification. The next specimen is a well preserved specimen of sago spleen, which shows localized deposits involving splenic follicles. It it is known as sago spleen because it resembles sago seeds, that is sabudana seeds, and in this specimen you can be asked about the entire amyloidosis, the primary, secondary, and guess what not. So that's all about the specimens of general pathology, and thank you for listening till the end.